Welcome to today's session, and thank you for taking the time to join us, the UpToDate Learning Forum. Today's session is exploring the powerful features of UpToDate, and since we can't be with you face-to-face, we've included photographs of your presenters for the session today. My name is Christine Berry, and I'm the Director of Global Training at UpToDate. Joining me is Joanna Mensch, one of our training specialists, and Carolina McCauley, who's our Director of International Market Development. UpToDate is an evidence-based clinical knowledge system, and it was designed to provide answers to clinical questions at the point of care. The content is continually updated, and over the past 20 years, the product features and functionality have been continually improved and enhanced. So currently, to give you a sense of the content, UpToDate contains more than 10,000 topics that are written by more than 5,400 world-renowned authors, editors, and peer reviewers who review more than 450 journals. The content covers currently 20 medical specialties, and this number will be changing to 21 on Thursday, February 28th, when we launch or officially launch our new dermatology specialty. UpToDate contains a full drug database of more than 5,100 unique drug topics in adult, pediatrics, and international drugs. The content is fully referenced and contains more than 367,000 Medline references. So that's a brief overview of the content. And now I'm going to turn this over to Joanna, and she's going to present the powerful features.
Thanks, Christine. So here on your screen, you're now seeing a list of the powerful features within UpToDate that we are going to explore during today's session. First, I'm going to briefly review each of these individually, and then I'll launch into a live demonstration of UpToDate where we can see these features in action. UpToDate provides a summary of information within the topic review, as well as relevant clinical recommendations in the summary and recommendations section located at the bottom of most topics. We've added this summary and recommendations button to provide a quick jump to this section, helping to make UpToDate quick to use at the point of care. UpToDate has partnered with Lexicomp, a Wolters Kluwer sister company, to provide comprehensive drug information. The Drug Interactions Database, also known as Lexi Interact, allows you to search for known interactions among an unlimited number of adult, pediatric, international, over-the-counter medications, as well as herbs. This database is easily accessible from the new search page and also from a hyperlink in the topic outline when viewing drug information. Within UpToDate, you can search an extensive library of trustworthy, high-quality graphics without having to use a separate search engine. The thousands of richly detailed graphics combined with the evidence-based knowledge in UpToDate creates a powerful and practical tool for improving your ability to diagnose and treat patients at the point of care. UpToDate provides over 1,500 patient education topics that clinicians can review with patients in the exam room. You can print them out as handouts or you can send via email. Like our clinician-level content, UpToDate patient topics are current, unbiased, and evidence-based. You can be confident that the information provided to your patients is concordant with the clinician-level information. UpToDate continuously reviews the latest medical literature and updates the content when necessary. Our authors and editors highlight the most important changes and updates within each specialty in this What's New section. In addition, within the What's New tab, there's a section called Practice Changing Updates. Practice Changing Updates highlights significant changes in clinical evidence that our authors and editors feel will change usual clinical practice. UpToDate also includes 135 medical calculators to help you quickly and accurately calculate many different medical measurements. To view a list of calculators available, you can click on the Calculators tab at the top left side of the page. They are also hyperlinked throughout the topic. Finally, UpToDate is accredited and recognized by colleges, associations, and authorities from around the world. Clinicians who access UpToDate through an EMR, portal, or other integrated system can earn continuing education credits every time they research a question using UpToDate, all at no additional cost. And I do want to mention that this feature is available for some and is based on the license type that your institution has available. So now that we've reviewed these, let's go ahead and launch into the live demonstration of UpToDate. I'm going to go ahead and share my desktop, and you will see the live UpToDate screen. No matter how you access UpToDate, whether it's from your EMR, your web portal, or just logging into the website, you will eventually be brought to our home screen. Here, you'll see the new search box in the middle of the page. To demonstrate the first powerful feature of UpToDate, I'm going to research a clinical question. Let's say I'm a general practitioner treating a patient with asthma who has recently become pregnant. I want to review the treatment recommendations for asthma during pregnancy. So I'm going to come to the new search box here, and I'm going to begin typing in asthma. And you'll see that as I begin to type, UpToDate predicts the text that I'm going to use. So it knows what I'm looking for. You can also use common medical abbreviations, such as PE for pulmonary embolism. I could scroll down here and choose asthma and pregnancy, and it would take me right to that section. But for today, I'm going to continue typing it in. And I'm going to highlight our toggle button. You'll see if I click on this arrow, a drop-down menu appears, and you can choose between adult, pediatric, patient information, or graphics. For today's search, I'm going to select all topics and then click search. And I'm brought to our search results page. The toggle button is still available over on the left-hand side, so you could still sort if you wanted to, and the search results are here in the middle. The search results are ranked in order of relevance to your search terms. So as I hover over each of these search results, you'll see that a topic outline appears over on the right-hand side. This topic outline is fully interactive and clickable and allows you to jump right to a specific section. For today's example, I'm going to stick with management of asthma during pregnancy, and I'm going to click on that, and we're brought out to our topic review. You'll see that the topic outline is still available over on the left-hand side, and our first powerful feature, the summary and recommendations button, is located right at the top. By clicking on the Summary and Recommendations button, you're jumped down to the bottom of the topic review to the Summary and Recommendations section. Here's where you'll find quick answers to clinical questions, as well as any actionable recommendations that pertain to treatment plans. You'll see here that we have information about our clinical question. It says the 4 important components of effective asthma therapy during pregnancy are. And then if I scroll down just a little bit further, it highlights specific medication preferences, and it says for relief of acute asthma symptoms, we suggest using the short-acting beta agonist SABA albuterol rather than other SABAs. You can see how quickly I was able to find the answer to my clinical question. For anyone who's not already familiar with the layout of our topic reviews, you can see the order of information within the topic outline. So we begin with the introduction and we go through various topics. And as I scroll down, you'll see the summary and recommendation section is here at the bottom. This is where our summary and recommendations button is taking us. So having it moved up to the top provides quick access to jump down to this bottom section. This is just one of the many features we've incorporated into UpToDate over the years to make it quick and easy to use at the point of care. So moving on to our next feature, part of the recommended treatment plan for this patient is to prescribe albuterol. UpToDate offers an extensive drug database of over 5,100 adult, pediatric, and international drugs. In addition, the Drug Interactions tool allows us to quickly analyze any potential drug interactions from within UpToDate. So if I click on this New Search tab up in the upper left-hand side, you'll see the Drug Interactions button just below the New Search box. If I click on this link from the New Search page, we're brought out to Lexi Interact. Lexi Interact is LexiComp's interactive drug-to-drug, drug-to-herb, and herb-to-herb interaction analysis program. Within Lexi Interact, you can select an unlimited number of adult, pediatric, international, over-the-counter medications as well as herbs. So for today, we know we're going to prescribe albuterol for our patients. You'll see here, this is a list of drugs that I've actually searched for in the past. This is my computer automatically populating this. LexiComp does not have the predictive text like we do in the new search box, but my computer provides that for me. Just want to be clear about that. I've had questions about that in the past. So for albuterol, I'm going to type this in, and I'm going to click Look Up to add this to our list. You can also just hit Enter. I'm also going to add Advil because our patient mentioned that she's been taking it for headaches. And again, click Look Up and add that. You'll see a list of the various types of Advil listed below. For today's purposes, I'm just going to choose Advil OTC. And finally, our patient's been a heavy coffee drinker, but she's switching to green tea to cut back on that caffeine. So I'm going to go ahead and search for green tea. And again, click Look Up. Now, I've listed 3 here, but you can, again, choose an unlimited number of interactions of potential drugs and herbs. And I'm going to click Analyze. And here you're brought to a customized analysis of these particular drugs. I can see that albuterol actually has no interactions identified, but Advil and green tea do have an interaction. In front of green tea under Advil, I can see the letter D. This is associated with the risk rating. So if I click on risk rating, you'll see a definition of all of the letters for these risk ratings. A is no known interaction. B, no action needed. C, monitor therapy. D, consider therapy modification. Or X, avoid the combination altogether. If I click on green tea, this hyperlink below Advil, I'm brought out to the interaction monograph. Here you'll find a summary of the interaction as well as patient management information. If I were to click on one of the drugs underneath the Analyze list, such as albuterol, I'm brought out to all of the known interacting categories for that particular medication. Let's say I just wanted to see the ones that were most interactive, and D and above. So I can use this toggle button here and select D, and this will just show the interacting categories for D and X. So now I know my treatment plan, and I've also checked for any potential drug interactions. I might want to pull up a graphic to show my patient as I explain the treatment plan and options to her. So I'm going to go back to my new search page, and I'm going to look for graphics. UpToDate contains over 25,000 pictures, figures, tables, graphs, algorithms, and videos. So if I type asthma into this search box, I can click on All Topics, and I can choose the Graphics Radio button below. This will sort my search to just pertaining to graphics, and then I'm going to click Search. Here you'll see a thumbnail view of the graphics search results, and I'm going to scroll through. I found a picture here that I like, and I'm going to open it up, and it will show me the image in the light box view. Here you can see the image as well as any details below explaining this particular graphic. Let's say I'm a nurse educator and I want to add this graphic into a presentation for my clinicians. I can export this graphic directly into PowerPoint by clicking on Export to PowerPoint. This will open up the graphic within my PowerPoint slide. It's fully referenced and contains the logo to UpToDate, and you can slide this right into any presentation that you may want to give. We also have the ability to print and email our images. Over here on the right-hand side, I can see all of the topics in which this graphic appears. And for this particular graphic, this is listed a bunch of patient information topics. And this will be a great way to transition directly into our next powerful feature, patient information. So I'm going to go ahead and click on asthma in adults. And I'm brought out to this patient information, asthma in adults, the basics. So UpToDate currently has over 1,500 patient information topics, and there are 2 levels of patient content. It's the basics and beyond the basics. The basics offer short 1 to 3 page topics that answer the 4 or 5 most important questions about a medical condition. These are written at the 5th to 6th grade health literacy level and use more basic terms such as belly versus abdomen. You can also print and email these patient topics, and we encourage you to do so and share them with your patients. So here I am in the print view. You could actually select to print the text and the graphics, or I could unclick graphics and it would just print the text. Let's say I wanted more detailed information. I can go to Beyond the Basics. If I choose Patient Information, Asthma, and Pregnancy Beyond the Basics, you'll see there's a very different look to this patient information topic. Our topic outline has reappeared over here on the left-hand side. Again, fully interactive and clickable, and the content is in the middle. The Beyond the Basics are longer, more detailed topics that are written at the high school health literacy level. All of the patient information topics are written by UpToDate authors and editors and are updated continuously right along with our clinical level information. So you can always be assured that the information within the patient information topics is current and concordant with the professional level content. So you and your patient are always looking at the same information. There are a few ways to find patient information within UpToDate. So I took us here because I was looking at an image that happened to be placed within a patient information topic. But let's say you just want to look for patient information from the get-go. I can go up here to the navigation bar and I can click on Patient Information. You'll see here the basics and Beyond the Basics. If I click on View All the Basics, you'll see a list of all of the topics that we offer. Also, you'll remember up in this new search box up here, we have the toggle button. One of the options that you could choose for your search is to click the patient radio button, and that would bring your search towards finding just the patient information. Clinicians who use our patient information tell us that it helps them save time and communicate with their patients better. And patients tell us that it helps them improve their own care and become more confident about their health choices. So that's our patient information. To wrap up our final 3 features, I'm going to take you along the navigation bar at the top left side to demonstrate what's new and practice changing updates, the medical calculators, and then finally continuing education. So if I click on what's new, this represents additions to UpToDate from the past 6 months that were considered by the authors and editors to be of particular interest. These topics are arranged here by specialty, So sticking with our theme of our patient today, I'm going to go into the obstetrics and gynecology section here. And you'll see a list of the subtopics that have been updated. So here I've got something about in obstetrics about DTaP during pregnancy. You can see the summary of the update that was made. And you can even click on the hyperlink that takes you directly out to the topic and the section where this information was changed. Here you'll see a list in the topic outline where each of the topics are divided by subsection within this particular specialty. If I go back to the beginning of the What's New tab, at the very top you'll see something called Practice Changing Updates. Practice Changing Updates highlight specific recommendations and updates that we anticipate may change usual clinical practice. So, for example, if you were to treat a patient on Monday and then read a Practice Changing Update on Tuesday, you would treat a patient differently on Wednesday. So it's really going in and changing the way you practice medicine. This section provides easy access to review the most recent changes within UpToDate and allows you to stay on top of the latest clinical information. So over here in the topic outline, differently from the way the What's New sections are listed, this information covers all specialties and lists the information chronologically with the most recent Practice Changing Update at the top of the topic outline. Practice Changing Updates cover about the past year or so. Next, we have medical calculators. So UpToDate contains 135 interactive medical calculators that allow you to enter values into commonly used formulas to obtain numerical data. So again, sticking with our theme here today, we'll click on obstetrics calculators. And our patient is very newly pregnant and wants to know her estimated date of delivery. So I can actually click on this first calculator here. I'm going to enter today's date. And the date of the last menstrual period. And you'll see that our calculator has populated the current gestational age of 5 weeks and 5 days, and the estimated date of delivery is October 24th. Now I'm going to go ahead and log into my own personal user account here. And I'm going to begin to show the continuing education. So you'll see I just got a new tab up here at the top. If I click on this, you'll see the continuing education credits that I've earned over the past several months. You can earn continuing education for every clinical question you research. So, for example, if I were to type in here in a new search box, carpal tunnel syndrome, and you can see UpToDate again is predicting what I'm looking for. I'm not looking for graphics, I'm looking for all topics, and I click on carpal tunnel. Again, you'll see our search results. Nothing's changed yet because I haven't really gotten into the information that I'm looking for. So now that I click on treatment of carpal tunnel, you can see that the number has changed from 37.5 to 38.0. So I have now earned 0.5 continuing education credits now that I'm in the bulk of the information here, really within the topic review, and I'm researching information about carpal tunnel. I can click on my tab again, and now I want to redeem my credits. Maybe I don't want the CMEs for this particular setting. Right now I'm at a physician setting in North America. I'm looking for AMA PRA Category 1 credit. I can change my settings, and here's a list of all of the types of credit that you can change your settings to. So if I'm in Canada, I can do CFPC Main Pro M1 credit. I can do AANP, nurse practitioner contact hours. We also have time-based tracking, for example. So you can change your settings there. If I want to process the credits that I've earned, I click on the month, and this will open up a reflection screen. This is where you're going to indicate how you use this information and applied it to your practice. So for the treatment of carpal tunnel, I was looking for treatment information, and I'll say this modified my plan. For the management of asthma during pregnancy, again, I was looking for treatment information, and I'll say this reinforced my plan. You can see that it's adding 0.5 credit here for me, and it's also going from green to white. So I'm going to scroll down here, down all the way to the bottom, and I'm going to click Save. And you can see that I now have 1 completed credit. I'm clicking on the Submit box and hit Continue. I'm brought to an evaluation. We ask that you complete this evaluation survey for us. It's not required. Here you're going to be asked to verify your submission. This is sort of our point of no return, if you will, and click Submit. And I can also view and print a certificate of completion. So if I open up this file, you'll see my certificate of completion that I've participated in the Internet point of care activity, and I've been awarded 1 AMA PRA Category 1 credit. Again, CME is available, or continuing education is available to people with certain license types. So if you have questions about whether or not you're eligible for CME, we want to direct you to your account manager here at UpToDate. So I'm going to go back to our new search page here, and I've wrapped up all of the powerful features that we're looking to cover today, and I'm going to turn things over to our question and answer section. So I'm looking here at some of the questions that are listed. I see here, how often is What's New updated? So What's New is updated continuously. All of the authors and editors continuously review over 460 medical journals and make changes to the content as needed. If something happens within a particular section that is deemed of relevance, important relevance, then it's added to the What's New section, and it's continuously updated. How many medical calculators are there? There are currently 135 medical calculators. So if I click on the medical calculators section, you can see here there is a library of calculators available by specialty. So you can see the list. If you clicked on a particular specialty, you'll see a list of all of the calculators that are available for that particular specialty. Let's see. Are there any copyright restrictions with your graphics? So with the graphics, you are able to export them to PowerPoint. And what you can do is you can use them in your own presentations. You do need to get permission from UpToDate in order to incorporate them into any publications. In order to get permission, you can actually go up to this Contact Us section, which is available from any UpToDate screen once you're logged in. And under this toolbar over here on the side, you'll see a section called Permission to Reproduce. This is actually a form that you would fill out and send in to get express written consent from UpToDate in order to use the content. Next question I'm seeing, can you search for a specific calculator in the search screen? Yes, you can. So let me go back to our new search screen here. So let's say I've just popped into UpToDate. Again, however you approach it, from your EMR or just going to UpToDate.com, I can search for a medical calculator. So let's say I'm looking for a BMI calculator, for example. I can type in BMI calculator and click Search. And you'll see that I'm brought right up here to the calculator for BMI, or body mass index. This will bring us directly to our calculator here. Even with this calculator, you can see the specific formula that's being used at the top. When you send a topic via email, does the recipient have to have an UpToDate subscription? No, they do not. So let me show you briefly how to use the email function. If you've never done this before, it's quite fabulous. What it does is it takes the information and it puts it directly into the body of an email. So let's go back to the asthma search, and I'm going to do all topics. It's going to bring up the overview here. So I'm reviewing. This is a clinician level information topic review. And if I click on this email icon over here in the upper right-hand corner, you'll see that our email screen is listed. You can enter in multiple email addresses. You can modify the body of the message and then click send, and that will go directly to your recipients. So I think that's all the questions that we have right now. Please feel free to continue sending them in, and I'm going to turn things back over to Christine Berry.
Great. Thank you, Joanna. You know, UpToDate is a valuable resource. It saves clinicians time and has been associated with improved patient care and outcomes. So for that reason, we're sure that you want to make sure that all clinicians within your facility know that UpToDate's available, help them know how to access it, and then let them know how to use it most effectively. So to help you in this endeavor, UpToDate has developed training materials for your use. These training materials are complementary, and many of them can be customized to fit your organization's specific needs. So now what I'd like to do is take you out and show you where the Training Resource Center is located on our website. So as you can see, I'm in the new search screen, the home page. And if you click the About Us button at the top, it will bring you to this page where you will click on the Product button, and you'll get a drop-down menu, and you can see the Training Resource Center here. So when I click on the Training Resource Center, this will give you a visual of the various categories of materials that are located within this tool. And I'm going to spend a few minutes and click within some of them and show you some samples. But before I do that, I just want to say I think the best way to approach this if you are somebody who's charged with increasing usage of UpToDate at your facility is you really want to think about a campaign or a strategy that you can set up that might, you know, have a plan developed for maybe the next 3 months or 8 weeks that includes a variety of these tools and helps all clinical groups understand that UpToDate's available. So we have some communication templates, and I'll just click into this section. And I'll show you the list of communication templates by topic. And these are all, when you click on them, you're actually brought to another section within our website. And what you're going to do is just really copy and paste and put this content into a Word document that you can massage and customize and reformat in any way that you choose. And then you can use this content to push out in an email blast, post on your intranet, create an article for your newsletter. So there's a variety of uses for the communication templates. And as you can see, there's some targeted to various clinical groups. So these are constantly updated, so I would suggest that you just take a peek and see what's in here. So going back to the main Training Resource Center page, there's some printed materials which are available in the PDF format, and these include user guides. This Powerful Features document is a great tool to distribute throughout your facility just to give your clinicians a visual of the various product features within UpToDate. So that's what that looks like. And again, back at the home page, we have a certified trainer program. and I would welcome you to take a look at the information contained here. And what we do is we look for people within the facilities who would be a perfect candidate for this program. And this is typically somebody who trains others or who may be the super user answering questions about the UpToDate subscription and how to use it within your facility. We have online tutorials, which also, if you click on these streaming video demos, you can provide links and redirect your clinicians to watch videos on conducting a search or graded recommendations or various topics. Within the interface toolkit, we have a lot of widgets, browser searches, information on integrating with the EHR. So any option that might help you bring UpToDate closer to the workflow for clinicians. So there's some really useful information contained in here. And the last section is just the webinars about this Learning Forum series, where you can see the dates for upcoming sessions, and you can register for the session as they're coming up. So that's our Training Resource Center. I would encourage you to visit this page, and just, if you want, you can contact your account manager and they could help you develop a program or talk more about tools and materials and ideas for increasing usage within your facility. So I don't believe we have any more questions, so I think I'm going to go back to our PowerPoint slides. And I just want to show you the list of dates that are coming up for the next sessions. So you should be able to see that on your screen at this point. So the next session is scheduled for April 30th, and we'll send out email invitations to remind you to register again as these dates come up. And then I also just want to briefly say that after this session, you'll receive an email that will contain this presentation, and it will contain a link to the recording of this session. And we invite you to distribute that within your facility and share it with others that you think may be appropriate. As always, if you have any questions or comments, we would love to hear from you, so please send us any comments or questions you have to training@uptodate.com. I believe that's the conclusion of our session today. So we thank you for attending, and we look forward to being with you in future sessions.